Yep, that worked.
You know, they just
Okay.
said,
So,
turn
the
it,
clinical
click it,
evaluation
turn it on. That's all I
tool,
had to do.
like I said, it'll come with students. It also goes to the supervisor of the hospital. Right now, that's the emails of the floor. That's the only emails I have right now. But it's very simple, easy to fill out. It's very self-explanatory. But it's much easier for you and the student if you fill it out throughout the day instead of waiting. There's a place, DEC, and there's a column S. That's where the student writes their thoughts. I've had DECs who would say, you know, the student, go fill this out, and then we'll talk about it, and I'll put in my scores. Or the other way around. The DEC fills it out, says to the student, this is what I found, or do it together. So there is a scale. This tool was agreed upon by all 4 colleges. We took all of our clinical evaluations and compiled them into one. The scale is from 5, where they are independent, down to 2, where they're marginal, questionably safe. They may start at a 2 in some of these areas because they haven't ever had that experience. And we don't even expect them to be at a 5 when they're done with their whole clinical experience. There are some of these that, you know, going through all of nursing school, you've never had to deal with something like this. So how could you be a 5? How would you know? So it's okay. And the students should be made aware that it's okay to get 3s and 4s. 4 is, you know, they have to be supervised. You have to be watching them, but they are safe and accurate. And 3s, mostly safe and accurate. Sometimes you may have to step in and give them a little nudge, tell them a little bit about, you know, we need to move this faster. You know, sterility was broken. I would say that would be put down between a 2 and a 3. Do you have any questions about the scale and how to judge that? Okay. And then the assessments that we have, the interventions that you're going to be evaluating, how do they assess? Do they prioritize? Like with the doctor's orders, do they know which ones to do first? Do they know in a patient who is having an acute, say, asthma exacerbation, where are they going to start their assessment? You know, maybe if they started with their pedal pulses, you might say that that wasn't quite where we should have started. And then my students do care plans. The Fort Hays students will do care plans. If they ask you for help and you know how to help them, great. If not, that's what I'm there for. But you know about nursing diagnoses. They might need some help determining what those are. Planning, again, figuring out what care they need to give, and this is before they actually implement it, to know what they need to do for what diagnoses, and to be able to teach the patients, because as nurses we do not take credit for teaching. Every opportunity that we're with a patient is a teaching moment, so we should always be figuring out, you know, anytime I go into this room, I'm carrying this medication or I'm taking this piece of vital signs equipment, what am I going to teach this patient? How am I going to teach them? Like I said, the interventions that they're going to use, implementation, how they implement these interventions, make sure, of course, that it is safe. The medications, quiz them, quiz them, quiz them. Every time they go in the room, they should be asking, what's your name and date of birth? Follow all 6 rights. IVs, some of them haven't had a chance to do those. We talked about some of those strategies earlier, and some of them, I don't know about the other schools, but Fort Hays doesn't have an IV pump like Hays Med does, because our pumps here are new. So they may have never seen an IV pump like this either. They may need some real guidance on that. So there again, it's okay for them to have maybe a 2 or 3 in that area. Policies and protocols. No one outside of an employee of Hays Med can get to our policies anymore. They may need to be shown how to find policies, but once you show them how to find the policies, make sure that they read them. and follow them. Evaluation, when they discuss with you what happened because they did this. Those are the outcomes, and showing that what they thought should happen, and then going back and saying, you know, this didn't happen and this may be why. It's how to assess through evaluation. Communication, very, very important. Remember in nursing school you'd never spoken to a doctor and you were scared to death, and sometimes you still are, because I've been doing this a long time and sometimes I'm still scared to speak to the physician. It's okay to give them coaching, give them a little help, but if they have an opportunity to call a physician or the pharmacist, or to call a family member and report what's going on, it's great for them to work with their communication. Like Becky said, talk to them about lab results and diagnostics. A lot of times it's a whole new experience to them to see an x-ray up on the computer screen. So it's always fun for me to go through stuff like that with them and have them say, do you know what this is? Do you know why this is? What are you seeing? So professionalism, of course, they should all come in clinical dress, ready to work. Follow the policy of the facility for the dress code, but they also need to build some self-confidence throughout the time. So like the identifies own strengths and weaknesses and makes changes, that should really improve throughout the time, because they're learning how to become more professional and how to communicate more appropriately. You guys know professional, ethical, and legal standards. Sometimes these students don't understand that. If the student wants to, situation that's happened in the past, the student wants, they get to be friends with the patient, and the patient wants to exchange phone numbers with them. Totally unethical. So anytime, please send them to the KSBN website for the standards of practice and for the code of ethics. Hopefully, especially the ADN students who've been out there, they've already gotten their LPN. They've had to go through that stuff, but some of the Fort Hays students may not be as familiar with those ethical and legal standards. You take the class, but then it's so easy to fall into something like that. And, you know, they're your friend, they're your patient. You want to get together with them and make sure they're doing okay after they're discharged. Hopefully, under professionalism, there aren't any twos. If there are twos, then I'm not sure I would continue with the patient without having the student, with the student without having the student talk to me, so that we can discuss those things. And then the DEC comments, every day, just make comments about what they did well, what they didn't do so well, areas of improvement, maybe the new procedures that they got to do, because the students are doing that also for all of their clinical instructors, so they're seeing that. That's your tool. Pretty easy.
When I gave them your evaluation, so you can see what they're evaluating you on, I thought that would be fun reading. The DEC evaluation.
Yeah, the students do perform an evaluation on you, and
you need to know too what they're going to say about you. What they're going to evaluate from your performance.
At the end of the collaboration this semester, you guys should be getting an email to evaluate the students, and it's completely anonymous. That's part of how we're going, or to evaluate the whole experience, not just the students. So please, when you get that, fill it out and be honest about it.
It would be fun to be a teacher. You've always wanted to do that, didn't you? After having gone through nursing school and had comments about your own faculty members. Whether it looks easy or not easy, now you get to try it and see. Try that yourself. That'd be kind of fun.
It has been such a good experience.
It sounds really neat. I bet. I think this is going to be something that's going to continue. I bet the board's going to like it. So all the people and everybody in Kansas is looking at this pilot to see, other schools, to see how well it's working.